My name is Martha Savini, and I'm with the Lexington Chamber of Commerce. For today's Chamber Spotlight, I'm here with Elizabeth Dishman of the IV Garden, which recently opened at 189 Bedford Street.
Hi, I'm Elizabeth, and I'm just going to start your IV for you.
Great.
So while we're doing this interview, I am giving you an immune boosting infusion. So we've already started your IV. It's good to go. And then I mixed up this bag of fluids with some vitamins that are going to help your immune system stay nice and boosted during this winter cold season.
Thank you.
You have B vitamins, vitamin C, and some zinc.
Nice. So tell us, why'd you come to Lexington?
Well, when we were looking for the right place to open, we were thinking, what is a good place that is close to the city, but not right in downtown Boston, that's accessible. And we really like Lexington because we're all sort of in the area. Like I live in Arlington. And we just thought that it was a good demographic because everybody here is health conscious. We also really love that this town is focused on the environment and being eco-friendly and that kind of thing, which, believe it or not, as a medical business, that's important to us. We try to consider our footprint as much as we can. And we looked at spaces, not expecting to even find anything, and we found this place the first time we went out, and it just seemed perfect.
Great.
Yeah.
So for those that don't know about it, even though we're in the middle of it, what is IV therapy and IM therapy?
So IV therapy is using a small needle to insert a little plastic catheter into a vein. This is the most common vein right here, right in the bend of the elbow, called the antecubital space. And that's usually where people are used to getting IVs and getting their blood drawn. And for quick stuff, it's a good place for it. And then this little plastic catheter just stays in your vein, and it allows us to put specially formulated fluid right in that's going to hydrate your body. This particular fluid is called lactated ringers, and as opposed to the common one that people hear of, normal saline, it has some extra electrolytes in it. And then, like I said, to this one I added B12, vitamin C, and zinc.
Great. So when would I expect to see the benefits from this?
So if you're dehydrated, you're going to start to feel better immediately.
Wow.
Bodies are very sensitive to the level of water. Usually people tell me I don't drink enough water, and that's pretty common. I don't drink enough water either.
It's hard to remember.
Yes.
So what's the difference between something like this and going to a drugstore and buying vitamins?
That's a great question. So the difference is that when you're going to a drugstore and buying vitamins, they're going through your digestive system. So the first thing they're going to do is stop in your stomach and get broken down by stomach acid. And then they're going to have to go through your gut and be absorbed. And by that point, you don't know exactly how much you're getting. Vitamins that you buy in the store, they actually don't have to go through FDA approval. So it's unclear sometimes whether they've done the third-party studies to show that their vitamins are formulated in a way that they can tolerate being broken down by the stomach acids. Independent studies have shown that oral supplements, you're probably on average getting 20%.
Wow.
Versus IV therapy, it's going right into your veins, and it's what we call 100% bioavailable. So it's formulated to be ready to go directly into your cells along with the hydration. It doesn't have to pass through your digestive tract, so it's not being altered in any way. It's already set up and ready to go right into your cells. So whatever your body's lacking, it can just take it right from your bloodstream. And so it's a much more efficient way. And then, like I said, vitamins that you're getting at CVS or another pharmacy, they're not necessarily being regulated by the FDA, versus all of the medications that we get have to go through a 503 compounding pharmacy, and they're all regulated by the FDA, so they all are exactly what they say they are.
Wow, that's a huge difference.
Yeah.
So you talked a little bit about what I'm getting here today. I was feeling a little bit dehydrated, but I would guess you have lots of different kinds of clients walking in the door that have different needs. Can you share a little bit about the different types of people you see and how they benefit from their treatment?
Yeah, so probably the most common is people coming in for dehydration, but we definitely see people for all different kinds of things. I would say the next most common is people coming in trying to recover from a viral illness. If they're really just not feeling their best after having had a cold for a week, but they're like, I need to get back to work, I want to feel better, then we'll usually give them some hydration and vitamin B, and it boosts their energy and everything like that, which is great. But some other things that I think a lot of people wouldn't necessarily guess that this is helpful for are things like chronic allergies or seasonal allergies. Some people, like the antihistamines like Zyrtec and Claritin, just don't cut it for them, but doing an immunity infusion during the height of pollen season every week or every couple of weeks makes a big difference, and they can go outside without feeling itchy or getting those watery eyes. Another thing that it's really great for is if you're preparing for an athletic event and you're doing a lot of additional weight training and you want to support your muscle health, we can do things like taurine or amino acid blends. So while you're really like working out your muscles and doing a lot of heavy exercise that you're not typically doing, getting those extra vitamins in there will support like everything that you're doing and maximize all the work that you're putting in.
So tell me, what other types of treatment do you offer?
So another one that we've started offering is an antioxidant infusion called NAD. And NAD is something that you produce naturally in your body. You start to produce less of it as you get older. But there have actually been some studies recently that have shown that it can be really helpful for long COVID. My doctor actually recommended it to me when I was experiencing symptoms from long COVID, not knowing that it's something that I offer at my practice. So I was like, oh, I will give this to myself and see how it goes. And I finally felt better after months of feeling just tired and having hot flashes and thinking, am I going through menopause in my 30s? I did the NAD treatment, and like all the congestion in my chest, the coughing, and just like the endless fatigue was gone, and I was so excited. And then what was really awesome was yesterday, we had done this for a patient last week who had had long COVID, and I had been telling him about it because he'd come in for just the regular immunity infusions, and I said, if it's really long COVID, I really recommend this. And he tried it last week, and then he left me a voice message saying that he was going to cancel his appointment this week because he felt completely better. So
Wow.
I was like, I'm so excited.
That's fantastic.
Like, I love that if you don't need to come back in because what we've done has helped you, and you're like, I feel great. So I was just thrilled. And then some other things that it's really nice for on sort of like the beauty side of things is we do IVs that support hair, skin, and nail health. So of course we all know, like, if you want to grow your nails or your hair, they usually recommend biotin supplements. But again, you don't necessarily know how much you're getting from the oral supplements. And also NAD, that antioxidant that's helpful for long COVID, it's been long known to be very helpful for skin health.
Oh.
So biotin and NAD infusions are really wonderful if you're wanting to like have that glowing complexion. NAD also has been shown to work on a cellular level to repair sun damage from like back in your youth. Oh. And so it's just a really cool thing.
Yeah. So do people often come in and get more than one treatment at a time?
Yeah, so a lot of times people come in and do an infusion and maybe an intramuscular injection. Mm-hmm. Most of the things that we offer you can get in the IV infusion, so we only need to do one sort of insertion of a needle, but things like vitamin D. Vitamin D is only formulated to go into the muscle. And we were talking about how IV infusions are 100% bioavailable. Studies show that intramuscular infusions are usually on average 80% bioavailable. So for people who are low on vitamin D and they've been taking the oral supplements and it's just not helping, I usually recommend 1 month of weekly IM injections of vitamin D. And if you don't have time to sit for a full infusion and there are some things that you want, we can do intramuscular like biotin or vitamin B. So you don't have to sit for a full infusion.
It's kind of relaxing.
Yeah.
So what about if a client would love to get some treatments, but they can't make it in, they're immobile, they can't make it into your retail establishment. Do you guys offer home health?
We do, yep. You can call and we'll set it up for you. We'll come to your house, we'll bring our portable IV pole and all of our supplies, and we can do it for you in the comfort of your own home. You can do it that way if you're having a get-together, and this is something sort of fun that you want to do. I've had people do it for book club meetings as like an extra fun thing to do once a year. I've had people do it for bridal showers. And then, of course, I'd had people do it for bachelor and bachelorette parties the next day.
the next day.
The next day, yes.
That's fun.
But we can come to you, whether it's that you're having a private event, or if you're just like, I'd love to just like relax on my own couch. We'll just sit and hang out with you and let you do your thing in your own space and monitor this for you and then pack up and go in your home.
That sounds great.
Yeah.
What else do you want to tell me about your business?
So aside from IV hydration, we do offer a few other services. We offer PRP, which is platelet-rich plasma, and we do a couple of things with that. We do hair restoration, and we do facial rejuvenation injections. So platelet-rich plasma is where we are drawing your own blood, and then we're spinning it in a centrifuge, and we are removing those red blood cells so that it's just the plasma and the platelets that remain, and it's sort of this golden liquid. We call it liquid gold because it has all of these growth factors and stem cells in it, and it does wonderful things. And it's your own blood product, so there's no chance of having a reaction to it. It's not foreign, so you're not going to have an allergic reaction to it, which is great. And for hair restoration, we inject it in the scalp in areas of thinning, and this is for both men and women. For whatever reason they're experiencing thinning, whether it's just hormone related, age, or if you have alopecia areata, where you have those coin-shaped patches of hair loss, and just injecting it into those areas, those follicles that have kind of gone dormant for whatever reason, whether, like I said, it's hormone related or an autoimmune disorder. The platelets go in and hang out right at those follicles and stimulate them to grow hair again. So,
wow.
Yeah.
It's pretty cool.
It is. It's really cool. We have some great photos on our website of one of our patients from the time prior to starting treatment, and he's at his second treatment, and he's already experiencing like a really good deal of hair regrowth, and he's really excited about it, and he still has one more treatment. So
yeah, he must be thrilled.
Yeah. And then for facial rejuvenation, I always say if people aren't quite ready to commit to fillers for like the under eye area or what we call the nasolabial folds or the marionette lines, if you're not quite ready to commit to filler, I've worked around filler for a long time. I've been in dermatology for a long time, and it's very safe. But for whatever reason, I was always like, I don't know if I want to do it. And the platelet-rich plasma is great because, again, it's your own body's blood product. So, it's going to go in and naturally create a fullness in these areas that as we age, they start to have some fat loss and some fine lines. And it's going to help rebuild that collagen, reduce the fine lines, and just fill in these areas that start to sort of sink as we get older.
Yeah. I'm glad you mentioned you were in dermatology. A lot of people might think it's kind of weird that you go somewhere in town, hook up to an IV.
You're not in a hospital or a doctor's
right.
office.
It's not the typical medical environment that people expect. Tell us a little bit about your background. I know you have some partners and your medical sort of knowledge that has gone into this business.
Yeah, so I've been a nurse for 10 years this year. And I was a paramedic before that, and I was a massage therapist before that. So that's my sort of medical journey. But I've worn a lot of different hats in the nursing field. The main one was working in dermatology. So I do think it's important for all of our clients to know that we are licensed and certified in what we're doing. We have all gone to nursing school. I'm an RN. One of my other partners is an RN, and our medical director is a nurse practitioner. And we've all had experience in a lot of different areas. We all met at a dermatology office about 7 years ago. So we've known each other for a long time. We work really well together. And we all have that background being in dermatology where we have like a deep care for patients' health and well-being. We also understand the aesthetic side and the importance of just feeling good about yourself. So this is such a nice combination because we're getting to do things that are going to boost people's health and wellness, and also things that are aesthetic in nature and are going to make you feel good about the way you look, which makes you feel good inside too.
Well, I have to tell you, I feel great, and I've never done anything like this
Really?
anywhere. Yeah, this is I'm your guinea pig, I guess, here today. But
Yeah.
I do feel great. Go for a run right after this.
Oh, good. Yeah, if you're feeling dehydrated, like you said you were, it really does make you feel better, like almost instantly. Mm-hmm. Before I started doing IVs, when I was still just working in dermatology as a surgical assistant for skin cancer removal, I hadn't really heard of doing this as sort of like a non-emergent thing, just giving people an IV. And my younger brother, he decided to run a marathon without doing much training. And his girlfriend got him an IV as a present afterwards, and he was like, I didn't think anything of it. And he was like, I woke up the next day and felt fantastic having done this marathon and not trained for it. And he also lives in the Caribbean and works in the sun, and he was like, I was just shocked. He was like, I thought I drank enough water, but he was like, my chapped lips disappeared. Oh. He was like, it was amazing. And I was like, yeah, that's another thing. It's also can be a cure for sunburn, because when you're in the sun and you're getting a sunburn, it's actually like pulling the water out of your skin and drying those layers of skin. So in the summertime, right now we're in the wintertime and the immunity time, but in the summertime, if you've been in the sun too much, getting hydration definitely helps.
Yeah. What would you say your most popular treatment is?
I would say the immunity IV probably. Since we opened October 27th, we were like right in that cold and flu and COVID season. And now that we're getting into the new year, we're starting to pick up on the New Year resolutions. I want to slim down for the summer, and we're seeing a lot more semaglutide patients.
What's that?
Semaglutide is the generic for Ozempic, that weight loss medication. Mm-hmm. Okay. Yeah, so we do that here as well. And it's a really awesome medication. It works in a number of different ways to help people with weight loss. We have a couple of IVs, like I was telling you earlier before we started the interview, that there are a few things like the B-lean IV and the lipomino injection, which can boost your efforts of like dieting and exercise. They can help you convert fat into energy and just maximize the results of all of your hard work. Semaglutide works a little bit differently. It's working by slowing down your digestion so you feel full faster, and you're not thinking about snacking in between meals. And it also works on that part of your brain that sort of does things compulsively, like snacking. Like if you just see the bowl of chips, or you know the bowl of chips is in the drawer, it makes you just not even want it.
Wow.
Yeah.
Sounds like a miracle.
Yeah. We've had people tell us that they always crave sugar, but when they started semaglutide, they didn't want sugar anymore. We've had people tell us that they didn't want to drink alcohol, they didn't want to smoke cigarettes, they didn't want to gamble.
Wow.
it just really works on that compulsive part of your brain that sort of just habitually does things. And a lot of snacking that causes that like extra weight gain is sort of that habitual, like, I know it's there, so I'm just going to eat it because, you know, maybe tomorrow I'll stop eating the stuff.
Yeah, that mindless eating in front of the TV, it kind of takes away that craving.
Exactly.
And that's via injection as well?
Yep, and that's even easier. I always compare it to, like, if you've ever seen somebody who's diabetic giving themselves a little injection in the tummy, you just squeeze a little bit and just a little, we call it subcutaneous. It's not even like a vaccine where it's going into the muscle, it's just going just below the skin. And it's such a small amount of liquid that has these dramatic results.
Wow. Sounds it.
Yeah, some people it takes 2 or 3 months to see the results, but I've also had probably about half the people I've seen will lose like 10 pounds in the first month and a half, which is amazing.
That's dramatic.
Yeah. And people are like, oh, I shouldn't have to like cheat like that. It's really not cheating, because when you've gotten into these habits of eating that way and your body is really craving these foods that are just not good for you, it's really hard to break that habit. And if this is actually helping you not want those things, then it's really gonna change your lifestyle even after you're off of it. Because I remember I love candy, and I remember people always saying, if you can just stop eating it for 7 to 10 days, you won't want it anymore. And I was like, but how do I do that? So if you're on this medication for 1, 2, 3, even 6 months, and you're not eating those foods that are trouble foods for you for that amount of time, by the time people come off of it, they've really changed their lifestyle and their eating habits, and they're able to keep the weight off, which is really cool.
That's amazing.
Yeah.
Well, thank you so much for sitting down today and sharing your business with us.
Thank you for coming, and thank you for being so cool and up for doing the interview with an IV in place. That was really awesome.
It's fun. Well, welcome to Lexington. We're happy to have you.
Thank you. We're so excited to be here, and we can't wait to meet more people.